Okay, so it's white male, 26, fever, disorientation, difficulty in breathing. Yeah, sounds like SARS to me. I'll tell him to the isolation unit on standby. Over.
I don't know when he got back. Sometime yesterday afternoon, I think.
And you didn't speak to him until this morning?
Oh no, I thought it's probably just jet lag. I mean, China's a long way, isn't it?
And none of your flatmates went in to see him?
Oh no, just me.
And you're sure you didn't touch him?
No, why?
You're sure you didn't touch him?
Well, it's not contagious, this, is it?
For many years now, the medical world has been warning of the possibility of a global disease outbreak. And in February 2003, that prophecy came true. A deadly new disease began to stalk the streets of China and Hong Kong.
One of the worries about the emergence of a new disease is that it can spread easily from human to human, such as influenza, but is able to kill many people. We know historically that the emergence of such viruses can cause an absolutely devastating impact on the human population.
There's a whole bunch of these what are called emerging diseases, and the one that we all think about is Ebola. You never get a natural outbreak of Ebola outside West Africa, and they very rarely get transmitted out of West Africa. So in that regard, SARS is more worrying, I think. Very unusually these days, doctors and nurses were catching an infection and dying. SARS came upon us as a shock.
SARS, or sudden acute respiratory syndrome, was first recognised early in November in China. As the situation was monitored, it became clear that there was a recurrent problem with the new mystery illness.
And what began as a problem in China and Hong Kong soon became a worldwide panic. Hitching rides on modern methods of transport, the mystery illness began appearing around the world.
It was obviously not a bacterial infection because they were giving people antibiotics, and those antibiotics had no effect whatsoever, so it was obviously a virus.
And on the 16th of March, the Health Protection Agency was approached by the World Health Organization to form part of an international laboratory collaboration to try to identify the agent which was causing the new mystery illness, SARS.
The World Health Organization announced its first ever global outbreak alert. But even as the worldwide scientific community commenced battle, the enemy was on the move. Without warning, SARS appeared in Toronto, Canada, causing deaths and closing hospitals. The people most at risk were healthcare workers. And across the Atlantic, the first SARS cases began to appear in the UK.
This is the Medium Secure Unit, which we use to nurse any patient we suspect of having SARS virus. The room has negative pressure, which basically means when I open the door, none of the virus can leak out. It is extracted through a specific ventilation system. We have a patient who we suspect is having the SARS virus, so I will now go in and gown up. I'm just going to put on some shoe covers, just basically to protect my shoes from anything that's lying around in the room. I'm just going to put on one set of gloves before I put on my gown. We tend to double glove with anybody who suspected SARS. Specific water repellent gown. There's more a barrier to protect me from any source of infection. And we've got our mask. But there has to be quite a good fit. You're trying to protect yourself. So you're trying to make sure that there's no leakage right around it. That the strap's just tight. Just kind of visor.
The final piece of Paul's defensive armour is a visor to protect his eyes from splashes of blood, vomit or diarrhoea. It's important because the eyeballs are a major route of infection.
Hi Daniel, how are you?
These barrier techniques meant that frontline medical staff in the UK were not being infected by the mystery illness. Back in the Far East, SARS was still raging out of control. Then came a breakthrough from a surprising source.
Unexpectedly, in the 21st century, the old classic techniques that have been used for 60 years were used in the first instance to identify this new SARS agent as a virus.
Electron microscopy is a technique which allows us to see tiny particles which are millionths of a centimetre in size and not visible by any other technique. First indication came from electron microscopy that there was a virus which had a halo that was typical of what we'd call a coronavirus.
A team of scientists in Hong Kong were the first to find the mystery killer. Looking down their electron microscope, they saw a totally new virus. Covered in spikes or knobbles, it looked like an old-fashioned crown, hence coronavirus. But what exactly is a virus?
In a way, viruses can be imagined like a little spacecraft going around, because the first thing that they do, and they have to do, is dock. And they have to dock onto a cell, because without a cell, they're just nothing. They're just a little capsule of nucleic acid surrounded by protein. They're not going to get anywhere by themselves. And then they have to get into the machinery, into the nuclear machinery, normally, of the cell, and take it over.
The breakthrough was quickly confirmed by other labs using a range of techniques. The enemy now had a name.
The timescale was exactly 1 month. On the 16th of March, the WHO convened its laboratory network, and on the 16th of April, the WHO announced that the cause of SARS was a coronavirus. We believe it was a successful piece of work. It was an unprecedented collaboration between scientists in a number of different laboratories, and it's certainly interesting to contrast the speed with which the SARS virus was identified compared with, let's say, HIV, which took several years.
Using the same techniques as in the Human Genome Project, scientists around the world soon determined the virus's entire nucleic acid sequence, confirming it as a coronavirus. But the discovery raised as many questions as it answered. The best known coronavirus is the one that causes the common cold. The new SARS virus was a very different beast. What was its origin, and what had happened to make it so deadly?
The first question one asks is, well, where's it come from? It's got to come from somewhere. They do not come from outer space. And there have already been big infections in Hong Kong, and in the last century, in the 20th century, huge global outbreaks of influenza. And when you trace back to their origin, where did they come from? We know now they came either from chickens, geese, ducks, in those live markets in Southeast Asia and Hong Kong.
The sometimes overcrowded and insanitary markets of Southeast Asia are ideal breeding grounds for disease, and the opportunities for a virus to cross over to humans are huge.
It's very important to find out where this virus came from. You can't just leave that as an open book. And it's very important to find out where it came from, because only then can you stop it doing the whole thing all over again.
Another puzzle thrown up by this deadly killer was how it was being transmitted.
Now, it's not highly contagious, which is lucky for us, basically. It's not like a highly infectious virus like measles, influenza. Is much less infectious. You will not get infected just by walking past someone in the street, even if that person is themselves infected. The chances of anyone else getting infected are quite low unless you bump into them. But on top of that, people who are infected, and when they cough, they'll cough out the virus, probably quite a lot of it. They'll contaminate their hands, they'll contaminate the surface where they are. So, you can get infected by doorknobs, lift buttons, other ways, as well as breathing in someone else's cough.
And that is exactly what happened in Hong Kong. A visiting doctor infected several guests at the Metropole Hotel. All those who were infected were staying on the 9th floor, leading researchers to think that they were infected via the lift buttons. Thankfully, the situation in the UK was much more controlled. The few SARS cases that did reach our shores were quickly hospitalised and quarantined.
My name is Dr. Ian Cropley. Today I'm just going to go and see somebody who has possibly got SARS. He's got signs of a nasty chest infection or pneumonia. He's short of breath, he's been coughing badly, he's had a high fever and a headache. Because of his recent contact with the Far East, we're extremely worried that he might in fact have SARS, and will need special tests and special isolation facilities to make sure that the rest of us don't catch SARS off him. So what we'll be doing is having a look at him, examining him, and taking various samples. We need to get samples from his sputum, from his blood, from his urine and from his feces, which we'll then send off to the lab to find out whether or not this is SARS or another infection. Hello, Daniel. My name is Ian Cropley. I'm one of the consultants here. My colleagues told me that you've been having a really rough time with this chest infection. What we need to do is to sort out exactly what's causing it. And because of where you've been, we need to make sure that it's not SARS. So we need to take some special tests. Okay, first of all, I'm going to take a throat swab. Let's
just move your oxygen mask. Can you open your mouth wide? Good. Okay, thanks. Can I just do some blood tests on you now as well, please?
Well, he certainly has got quite a severe pneumonia, and I think we'd be very worried that he has in fact got SARS, because he's got all of the signs and the symptoms and he's been to the right geographical area. What we have to do now is await the results of the tests, and in the meantime give him lots of intensive treatment.
The samples are dispatched for testing, but in the patient's body, a war is being waged. The external symptoms are headache, temperature, fever, aching joints, difficulty in breathing, and a dry cough.
I mean, the virus is replicating itself in the airways and will lead to shortness of breath, and definitely the person will feel pretty ill because of that. But the other symptoms will be caused by our own immune reaction as we battle the virus ourselves.
The body's immune system is now on red alert, causing aches and pains and a rocketing temperature. But the crucial fighting is in the lungs, which begin to fill with fluid, shown in white on this X-ray.
It is a battlefield. There will be destruction of the cells lining the airways. There will be immune cells roving around, almost like tanks roving around, looking for targets. And what they're looking for are cells in the upper airways infected with the virus. And then they'll fire off at those virus-infected cells. Sometimes they will miss, and they'll hit a perfectly normal cell, a bystander cell, and that's the so-called collateral damage.
Although the discovery of the coronavirus was a major triumph, medical science still has a long way to go. Maria Zambon's group is looking at new ways to test for SARS virus in patients.
The problem with diagnosis when the patient is ill is the actual sensitivity of the test. Detection of nucleic acid is quite sensitive, but it's probably not as sensitive as we need it to be to make a really good, accurate diagnosis. That's where it's really important to place the effort, so that we have a rapid way of saying this person has got SARS or this person has not got SARS.
But even with rapid diagnostics, doctors are still unable to fight the virus.
At present, we're unable to give any specific treatment for people who are infected with SARS, so what we can do is make sure that they have the best possible nursing care, the best possible fluid management and high quality support in hospitals such as intensive care.
Anti-SARS drugs are urgently needed, but the biggest push is for a vaccine, something Professor Oxford's group are very interested in.
I mean, in a sense, you can say that the spike is the main part of the weaponry of this virus, but also it's Achilles' heel at the same time, because it will be the source of antiviral drugs, and it will be used to make new vaccines against SARS.
The spike is what allows the virus to attach to human cells. It is also the part of the virus the body first comes into contact with, making the spike an ideal target for drugs and vaccines.
When it comes to making a vaccine, the spike will be absolutely crucial.
Inoculating people with just these spikes would mean the body's defense systems would already recognize the SARS virus as hostile.
So in the battle between you and the virus, you'll have the advantage, because your immune system's already underway, and you'll clear the virus. In a sense, more scientifically, I suppose, we will be looking for exocet missiles that would target themselves onto the SARS virus, a real exocet missile. That's what everyone would love to have.
In the meantime, vigilance and strict nursing procedures are our best hope for defeating this deadly new viral foe.
Although the control measures have been effective so far, it's important not to be complacent. We don't know where this virus has come from, and we don't know when it might emerge again. What we know about the SARS virus so far is that about 15% of all the cases worldwide have died. If we compare it with influenza, the case fatality for normal seasonal influenza would be less than 1%. So it's a major league virus.
Well, the mortality rate of SARS is high for any virus, even Ebola. So, that's been a strikingly worrying feature of SARS, its ability to get you into trouble and kill you.
One of the ways scientists predict how an emerging virus will behave is by looking at the history books. And the viral epidemic SARS is being compared to is flu.
Influenza in the 20th century occurred on at least 3 separate occasions as a pandemic, most notably in 1918. And it's estimated that more people died as a consequence of flu in 1918 than died as a consequence of World War I.
The outbreak in 1918 killed 50, 60, 80 million people around the world. I mean, that's almost impossible to grasp that. I find it difficult to grasp it. 80 million people dying in 1 year. That was the biggest outbreak of any infectious disease that the world has ever known. The 1918 outbreak had to begin somewhere. It just didn't explode instantly and kill 80 million people. It began slowly. It grumbled along, we think, in the army camps of the Western Front. But then suddenly, kind of after a period of about 6 or 9 months, it suddenly exploded. Now, you just have to think with SARS, well, could this be doing the same? Could it just be grumbling along now, and then in a year's time, bang? Just because the virus is not highly contagious at the moment doesn't mean to say it's going to stay that way. It could evolve into something much more threatening.
This is why the world's disease outbreak experts are worried. Although the SARS virus seems relatively stable for now, it has previously changed significantly, and experts believe it could change again. And there is another threat. Suppose a virus were to emerge with the killing power of SARS and the spreading ability of influenza, a super virus. The impact on society would be devastating.
It's important to realise that viruses do emerge at fairly regular intervals into the human population. It is possible to have a virus which is as highly infectious as influenza and as virulent as SARS, although we consider the emergence of such a virus very unlikely.
The emergence of a supervirus may be unlikely, but then no one predicted SARS. A supervirus may even now be lurking in some other species, waiting to jump across to a human host. Will medical science be ready?